what we're going to do here is tape a medial ligament, and basically the medial ligament's the ligament on the inside, but you can do exactly the same for the outside as you do for the inside here. So your lateral ligament will be the same tape, just reversed. Now, the position we like to get them into is just slightly flexed. So usually what I'll do is just put a slight, a small piece of tape underneath a roll or something just to lift their heel up, and which bends them slightly. Okay. Now the hard part with taping a knee particularly is the quads and the calf. Just they're not symmetrical, so you're going to get a few little creases around there. I wouldn't be too worried about it. The other thing that I'd probably use with someone, particularly guys, is either they shave their knee or they use the Tuff Skin, the adhesive spray. It just sticks better. With hairy legs, comes off after they start sweating, so you won't get that great adhesiveness. So basically what you want to do is just start slightly above the knee. So there's the kneecap. We usually do about 1.5 inches above the knee area. Now the big thing with taping around the thigh is those hamstring tendons at the back there. Basically you're going to use that as an anchor point, but you don't want to do it too tight because it will affect their hamstrings. A lot of players don't like them rubbing on their hamstrings, so just got to be a little bit careful there. And again, I'll usually use 2 anchors and just laying it on fairly loose. You want it nice and flat basically, but just not too tight so it affects their hamstrings there. And then the same thing with the calf. If you look at their knee, the tibial tuberosity, which is where their patellar tendon inserts, you want to go just below that area there, and again at a bit of an angle, and just laying it on so it's not too tight because it will affect their calf as well, and they don't want it too tight. So once they start running, all the muscles expand anyway, so you just don't want it too tight around there. Now basically what we want to do is we want to go directly over that medial ligament, which is just sort of about the halfway point between the front of your knee and the back of your knee. And basically what we're going to do is just go directly over that. So using your thigh anchors as a start is basically go nice and tight and lay it right down over the top of that. And you're going to overlap the tape by about 1/2 to 1/3 each one. And again, doing it nice and tight and flat. I've just come slightly forward. I'll go slightly back now as well. So basically I'm covering the whole medial ligament. And then just to reinforce that, what we want to do is make it cross. We're going to do some stirrups just straight across the medial ligament. So basically starting slightly at the front part of the thigh and crossing over in the midpoint of the medial ligament, and then just pulling it nice and tight and laying it down. And then we'll do one in the exact reverse. So we're basically crossing straight over the medial ligament. Now, depending on the severity of the tear, you can reinforce that a few more times, and again, just going slightly forward. So with a grade 2 medial ligament that's coming back, I would probably put, an extra couple of these on each way, just to reinforce. And laying it on nice and tight. Now just to finish off with, I like to use the hand tearable tape. The reason being is you just don't want to restrict the hamstring tendons at the back and the calf, and this just tends to give a lot more than the stretch tape that's got a cut off by scissors, sorry. So basically we're just going to go around the thigh, and again not too tight. Now I like to cover the whole knee area. Now it's a preference of the player through the back section behind the knee area that some players don't like you going through there. So, but with the hand tearable tape, it is stretchy, and I just find that going through the back section of the knee, the popliteal fossa we call it, it's not too restrictive with, but that's basically the end result of your medial ligament.